as the wider group. So our plan is to record part of the seminar. Fortunately for you, we're planning to only record the slides section. So the section where I'll be talking through slides and where Barbara will be talking through things. So now we're at this slide. So as I said, I'm going to share some of the slides. I'm going to share with you some of our data. So some of the analysis that's been run from our data. And then I'm hoping that will be a nice springboard into the discussions that we're going to have in our breakout rooms. So yes, as I say, so after this, in my next slide, I'm going to give a brief background into the measures that we have in the data set and why we use the ones that we have and their intended use. So I just wanted to provide you with a bit of background before I jump right into the graph that we've created, because I'm aware that lots of us are coming from different starting points and different vantage points, and I think it's great having, now you've all introduced yourselves, it's great that we've got a really wide range of experiences in the virtual room. So I'm really interested in the discussions that we're going to have and the sorts of different reflections that we're going to have collectively. So after I've sort of introduced very, very briefly some of the measures and their intended use, I'm then going to share with you some of the emerging findings from our CORC data set, where we've analysed the data from the measures using the principles of the Reliable Change Index. And it would, yes, so then I think we'll like to pause for us to have a think about these findings and what they mean to you, what they mean in the broader sense of what they mean, and how we can think together about whether it's important for us to consider these findings in relation to measurement choice. Then I'm going to hand over to our CORC member colleague, Barbara, who will share her experience and plans for measurement selection in Avon and Wiltshire. So I'm really excited for her to be with us today to share these ideas and plans with you, because I think it's a really interesting model to be working to. And so, as I've said, so this is very much a discussion-based session, and so it's going to be great to hear from you. And we're really looking forward to you sharing your experiences and thoughts and reflections. I do really want to say that we don't necessarily have the right answers for this. So, we haven't come here to give you the answers, but I think we can have a really good think together about the best ways forward, and just sort of planting seeds and thinking about really important things to be considering when we're thinking about the measures to use, under what circumstances, and given sort of other things that are going on in services and settings. And so really, when Barbara and I were thinking about the ideal outcome of our seminar, it was to think about how to select and use measures and to find this useful. So that's the key thing here, rather than, for example, selecting and using measures for targets. And so Barbara's going to speak a bit about that in a minute. A bit of background, so measures to date. So there are, as I'm sure you're aware, a number of outcome measures that are available to use with children and young people, which facilitate the assessment and tracking of their mental health and well-being. And in CORC and more widely in the NHS mental health services data set, there's a portfolio of measures which are widely used by professionals working to support young people and their mental health and well-being. And these measures have been primarily selected for wide use for their established psychometric properties, because they can be used to compare scores across young people for benchmarking, and because they're short and easy to use. And so in terms of intended use, some of the measures have subscales that can be used as standalone measures. For example, the RCADS has various anxiety and depression subscales. And the intended use of these measures is that they would be selected and used in a personalised way for the individual young person. And so they would be selected in conversation or suited to the work. And so, if you're working with someone who presents with anxiety difficulties, you might select the generalised anxiety subscale of the RCADS. However, we know that the measures are not necessarily being used in this way. So we come to the present, and we know that the measures are often administered in a blanket way to young people, And this is often to meet targets set at the service, trust or commissioner level. And we know that there's a real balancing act to the use of these measures to meet targets, to evidence outcomes at the high level, but also to measure meaningful outcomes with young people. And that's what I said that Barbara is going to talk a bit more about. And we'll have the opportunity to reflect on that a bit more in our second discussion a little bit later this afternoon. We also know that training and knowledge and trust in the measures also plays a part in measurement choice. And this is where we really want to focus our discussions today, to think about what goes into selecting and using measures and how we can best think about balancing out these factors in the most meaningful way. So why are we interested? So we're interested in this because NHS England and NHS Improvement in England have set an outcome metric across the board, which brings measures into the data set together. And they're exploring change in these measures through the use of the principles of the Reliable Change Index, which is a calculation which explores change that is over and above what can be attributed to measurement error or chance alone. And for this, all of these measures are combined into one calculation. And so one key thing we want to think about as CORC is whether the measures function the same or in different ways. And therefore, what would it mean to combine the scores from all the measures in this way? And we also want to think about why there might be any differences and what that might mean. And what it might mean for measurement selection and also for the implementation of this metric, along with other sort of targets and metrics that we know are implemented on local levels as well, and the impact, therefore, the knock-on impact of measurement use. Okay, so here's a graph that we have pulled together. So the data sitting behind this is derived from around about 120 episodes of care from children and young people who were seen for support with their mental health and wellbeing difficulties. And this graph shows a breakdown of the results based on the reliable change calculations for these measures and for the measures that we had enough data on. So there are some other measures in the data set that, for whatever reason, we don't have reflected here. So I just wanted to say that. It's also really important for me to point out that this graph is presented with thanks to our colleague, Luis Costa da Silva, for conducting the analysis that it sits behind this graph. And this analysis is from a paper we've submitted for publication. So this is not published just yet. And in that work, we're exploring the use of the principles of the reliable change calculation on our merged data set. So this graph has been derived from analysis based on a combined number of data sets. So within CORC, we hold 3 data sets: the snapshot one, which is where outcomes information are collected at 2 time points, time 1 and time 2. Then we also have the CORC Plus and the CYP IAPS data sets, which are derived from more session by session collecting of outcome information. And so we did a big piece of work where we merged them, and this is the outcome. And then what I did for this graph was just sort it by most amounts of reliable change. So we can see, for me, it's green. It might be a different color for you, but the left side of the 3 bars, green, shows reliably improved or reliable improvement. The red or I think it's actually orange, but it's coming up on my screen as red, shows no reliable change. And then the blue-grey sort of colour is reliable deterioration on each of these measures. And we've used the acronyms here. I'm happy to go into these in a bit more detail. I'm going to talk us through this graph a bit more. The thing that I really want to stress is a caution here before we sort of go into the detail of this graph. And the caution is that I'm in no way presenting this graph with the intended message of these are the measures to use to get the most positive outcomes. So I just want to be really clear and open about that. I just sorted this as a means to try to understand this data and these analysis in a clearer way, I suppose. But also, I just want to present this as one piece of information to help us consider our use of measures. And so, as I said before, we need to balance the use of measures at the individual level with the use of measures required to meet sort of targets. So I created these boxes to try to split this graph up a bit more. And I have to say they are a bit arbitrary. So these boxes aren't based on any statistics that I've run. It's just me from eyeballing this graph. And so at the top here, what seemed to be coming out of this to me is the goal measures and sort of more global functioning scales, which demonstrate the most amount of reliable change in our data set. Then here we've got this middle group. And here it sort of looked to me as though these on the whole are the symptom subscales. We do also have the CORS and the COR 10 in there, which are global functioning measures. So it's not as neat as a picture as, you know, I would have perhaps liked. So I think that's something for us to think about and discuss in a bit more detail. But on the whole, this middle sort of section where young people are saying that they're reaching sort of between 33% and 11% of reliable improvement seem to be related to symptom specific subscales. And then finally at the bottom are the subscales related to conduct, pro-social and peer difficulties. And when I was thinking about this, I wondered whether actually this bit at the bottom here, I think perhaps is to do with the nature of the difficulties rather than the measures or necessarily the outcomes. So something else for us to think about there. Before we break out into groups to think about this together, I wanted to share some reflections that Barbara and I had when we met to discuss this, because as I say, it wasn't as neat as picture as I had anticipated that it might be. And so we were sort of trying to think about what this could mean. And that's what we're going to talk about in our groups in a minute. So when we were looking at this graph together, we were wondering about the goals presenting the most amount of reliable change. And we wondered whether it's because goals tend to be used in a targeted way because you're setting goals that are of relevance to the young people. And so perhaps that's why they show the most amount of change. And then we have research from our group at CORC and others that suggests that goals may also tap into areas which are unexplored by other measures. And those tend to be areas related to things like existential change or existential factors. Then thinking about the symptom and other measures showing a smaller amount of positive reliable change. And we wondered whether that's because these are focused measures which we would imagine show lots of change because they're focused. However, we do know that that's not the case if they're used in a blanket way. So, for example, administered to every young person that comes through the door. And that's because in doing that, there will be measures that are given to young people for whom these just aren't relevant. And so we wondered whether there's something coming out there in relation to that. I also wanted to flag here to you. So we've got the ORs and we've got the CORS, which are the same measure, but different age ranges. So the CORS is the younger age version of the ORs, which is a global functioning measure. And so I've pointed out here on the arrows, so these two measures seem to be reflecting the least amount of change or you know, most of the most amount of reliable deterioration. And so we were wondering about this, and Barbara and I were reflecting that perhaps these measures are often given out in a blanket way. And so we wondered whether this now here is what we're seeing as an artifact of that. So we're capturing deterioration as well as improvements across the board. I was just checking the time, we're good for time. So before we go out into our breakout rooms, so these are the things that I would like us to reflect on. So that was a real whistle-stop tour, background of measures and the findings from our CORC data set. And I really want us to reflect on the graph that I've just shown in the first instance. And the two questions that we would really like to reflect on in our breakout rooms that we're going to go to in a couple of minutes is, or are the first two ones that I've got on this slide here. So these first two questions, and then we're going to loop back around to the third question after we've heard from Barbara. So we know some of the factors in choosing measures, but what we want to know is what else is a factor in the decision making when choosing and using measures, and should we take these sorts of results into consideration? So should we be thinking about what I've just shown you on the graph? What does it mean when thinking about the best measures to use with young people? And then the second question I'd like us to consider is, how is it best to choose measures? So what do you think it means that there's such variation in those outcomes that I just presented on the graph? Does it mean anything? And how can we best understand this and make use of the measures in a meaningful way? So good. I'm going to stop sharing my screen for a second so that I can see everybody again. So we're a couple of minutes ahead of time, which really pleases me, but I think we'll go straight ahead and go into the break.
Okay, so I'm Barbara. My role is the CAMS quality facilitator in Avon and Wiltshire Mental Health Partnership, which covers Bristol, South Gloucestershire and North Somerset. So I'm just going to say a bit about the model that we've developed over the last couple of years. So this is just a quick basic summary of our model, which we developed probably a couple of years ago in 2019. But it has to be said that it hasn't gone according to plan with the whole COVID coming into play, which has kind of paused things. But we are getting back on track a bit more in recently. So this model is based on the Thrive model, which also the CAM service is currently implementing. So we have, what really helps is we have a ROM champions group across the service, where we have a representative from each team, and we meet on a regular basis to discuss how people are implementing the model and what issues there are and any good practice that's happening, which has been really helpful. And we've just got that group back up and running in the last couple of months after it was paused since the first lockdown. So at the heart of the model is the goal-based outcomes measure. So we wanted to have a basic model that could be implemented across the whole service and across all teams, because we have a variety of teams that are locality CAMS teams, specialist services, learning disability services. So we wanted one basic model that could be adapted for different situations. So the goal-based outcomes is the main measure that's used in the service, or that's our aspiration anyway. And then underneath that, it would be expected that people choose an outcome measure that's related to those goals, but also to the child's age and to the problem. And also people would use the session feedback questionnaire or session rating scale. And so the minimum frequency that we ask people to use these measures is at assessment, review and discharge. So the very minimum is at 3 time points. And review would be after 6 sessions or every 3 months. And then at discharge, we also get service user feedback using the experience of service questionnaire. And we're hoping to also do a rolling 6-monthly snapshot using the experience of service questionnaire. And we've just developed a version of the experience of service questionnaire that we can use on SurveyMonkey, which will really help to get the information, because that's been something that's been difficult with not seeing people face to face. So just to say a bit more about the Thrive model and outcome measures. So the personalised goal of the young person or family can point to a standardised measure that might also be helpful to track progress. So if the goal might be having better family relationships, which is a very broad goal, but then a standardised measure, for example, the score 15 could be used to track progress. So just saying a bit more about the agreed goals. So if the goal was less symptoms of PTSD, then the impact of events scale could be used. Less low mood, the RCADS subscales, and manage compulsive behaviours, the OCD subscale of the RCADS. So that's quite a kind of basic way of looking at it, but that's the kind of idea. So the other influences that Jenna's talked about in thinking about what measures we use are the local KPIs. And of course, there is an increasing focus on outcome evaluation and the national outcome measure, with the results being published on and available to commissioners to look at. So that's a consideration in the measures that are used. And then there is a national sequin which was supposed to be implemented last year but was paused due to COVID, which it could be implemented later this year, we think, where the sequin will be about the actual number of questionnaires that have been completed. So the sequin would be achieving 40% of children and young people and women in the perinatal period accessing mental health service, having their outcomes measured at least twice. So those are the other considerations. And I actually stole this slide from CORC, from a presentation from a while ago, but I really like it because I think it captures that the dilemma between choosing measures for the purposes of service evaluation and for clinical meaningfulness, because it is really important to get that balance right, so that the service is not exclusively focusing on measures for service evaluation. And I know from my own experience from a few years ago, when the service did have a sequin which was purely based on the number of paired outcome measures, excuse me, then the focus was just on the numbers, and rather than how the measures are implemented or what the meaningful is at an individual service user level. So ideally, they would feed into each other, but I think it is difficult to get that balance right, and it needs to be taken into consideration that we can't just focus on the numbers of questionnaires that are completed. And so that's it from me. So thank you for listening. Has anyone got any questions at this particular point? I don't know whether we're going back into the groups now.